And we're alone.
It's all right. Hey, y'all, welcome to Cross Politic Midweek Fix. Pastor Toby, who's
not here.
Shock Knox, and I'm the Water Boy. We also have Dr. Scott Atlas.
I'm excited about this.
Coming on. Yes, sir.
He's got the inside info, man.
A plague upon our house.
Yeah.
What? This like Genesis? Exodus?
Well, it seems like Exodus, but I don't want to be Egypt.
Yeah. Make sure you guys share the show. It's good to be with you.
This ad is for our friends that are at Carpe Fide Podcast. The heart of Carpe Fide is rooted in faith, family, and facial hair. I qualify. Jesse and Justin both serve as elders in their local church and have a passion to equip the saints and help them in whatever way that they possibly can. Founded in 2020 in the heart of the pandemic.
A great year to find business.
And found a church too.
Yeah.
The two brothers watched as the world radically changed around them. They saw that the world was scared and Christians were faltering and leaders abandoning their call. This is why Carpe Fide sees the faith is such an important motto to them. They realize that Christians must grab their shields, take up their swords, and stand firm in the faith. To learn about their podcast, visit them, carpefide.com. That's CARPEFIDE.com.
Without further ado, let's get right into this. Let's introduce our guest, Dr. Scott Atlas, MD, the Robert Wesson Senior Fellow in Healthcare Policy at the Hoover Institute. I love the Hoover Institute. Dr. Atlas investigates the impacts of government and the private sector on access, quality, pricing, and innovation in healthcare, and is a frequent policy advisor to government and industry leaders in these areas, and I don't think they're listening to him. During the 2008, 2012, 2016 presidential campaigns, he was a senior advisor for healthcare to a number of candidates for president of the United States. He has also advised several members of the United States Senate and House of Representatives, are they listening, and testified to Congress on healthcare reform.
Are they listening?
Exactly. He served the nation from August to December 2020 as special advisor to the president and a member of the White House Coronavirus Task Force, and he's still alive. He has received all sorts of awards for his work in medicine, too many to list here. Dr. Atlas received his BS degree in biology from University of Illinois in Urbana-Champaign and an MD degree from University of Chicago School of Medicine. And he is the author, which is why we have him here, on A Plague Upon Our House, My Fight at the Trump White House to Stop COVID from Destroying America. Dr. Atlas, thank you for coming on the show.
Thank you for having me. Happy to be here.
So reading your book kind of just made me angry.
Made us all a little upset, actually.
Yeah, a little angry here. And at first, because the task force, the way you described it, their kind of rejection of reason and logic, not even just basic science, but just like reason and logic. And secondly, their cowardice displayed by kind of Mike Pence and some of the leadership who should have known better. Can you start here and connect the dots for our listeners regarding that?
Well, I came there as an outsider. I was asked by the president, by the White House, to help president of my country. Mm-hmm. And because I was a healthcare policy scholar, I had been doing that for 15 plus years, 10 years full time. Wow. And before that, I had a 25-year history of being in academic medicine, clinical research, and education. And so I said, of course, yes, I will help because people were dying. Yeah. The policy that was being followed, that was recommended by Dr. Fauci, Dr. Birx, who was the head of the task force, was implemented throughout the country almost without exception. It was failing to stop the spread of the infection. It failed to stop people from dying who were identified as high risk. And it was destroying particularly low-income families and our children. And so I said, yes, I will help. And so when I went, I was very different from everyone else. When I sat on the task force meetings, I was shocked at what I saw. Mm-hmm. The medical side of the task force, Doctors Birx, Fauci, and Redfield, were basically government bureaucrats. They had been in their positions for 35, 40 years in government positions. Okay, to do that means you're a different kind of person than I am. I came in as a health policy person. So I came in to meetings with stacks of published papers with the data. I went through and critiqued the studies that were done. I looked at study design and said, well, wait a second, this study design was wrong. Therefore, the conclusions are not valid. I was never met with a similar scientific response. I was never met with a critique of the studies. They never once, in my view, brought in a scientific paper to the meetings. I was met with accusations about being an outlier. These are people that have succeeded in their positions because they were not politically neutral, but because they were politically savvy. They navigated a highly politicized environment. They navigated it through their friends and agencies, through their friends in the media, and they covered for each other and were, frankly, concerned about their own position. So I was naive. Okay, I thought, okay, the information's important. I'm not just going to give the data. I brought in experts from all over the country. I brought in the people who were the high-level scientists from UCLA, from Stanford, from Harvard, from Tufts University, infectious disease experts, virology experts, epidemiologists, to speak and answer the president's questions. What was I met with? I was met with Dr. Birx refusing to come to the meeting, even though we specifically scheduled the meeting so she could come.
Wow.
Now, why would somebody refuse to come to the meeting? You could guess at that, but the meeting was scheduled so that people would have an interchange of answering the questions from the President of the United States, from the Vice President of the United States, with knowledge. And if you're insecure about your own knowledge and your reaction is refusal to defend your own positions, you're not fit to be at the table, frankly.
Right.
And then what happened was Dr. Birx went to the media and said there was, quote, parallel pathways of information coming to the president that didn't go through her. Thank God for that. My job was to give information to the president. The American people should be thrilled that other experts who are actually doing the pandemic research were coming in and talking to the president, answering his questions, answering the questions of the vice president. My job was not to filter information. My job was to provide information to the best of my ability, because, again, the policies that Dr. Birx and Fauci recommended were actually implemented. They got what they wanted by the governors, following what they wanted, and they were killing people, destroying families, and sacrificing our children.
I just want to jump to this. Why didn't Trump fire Dr. Birx and Fauci? Like, to me, that's one of the most obvious things that should have happened in all this. And even back in 2020, when 2020 happened, we do a show twice a week. We started doing a show every day in the shutdown because
information was being stifled. Nobody was in opposition to the narrative that was going forth.
And so, like 2 months into this, I was of the belief that, man, we need to get rid of Fauci and Dr. Birx.
Almost from jump.
Well, it's hard to answer the question why. I don't really know people's motives, although I do say this. Birx and Fauci were in charge of the pandemic response for 6 months, 6 months before I even walked into Washington.
Right.
When I got there, the policy had been in place. They were entrenched. In fact, they had commandeered the policy. The president was saying different things. The president was saying the lockdowns are harmful, school closures are destructive, let's open up things safely. Even before I got there, it was very common sense. In fact, it's logical when we know who's at risk to protect the people who are at risk and not destroy everyone else. And so it's hard to say why they weren't fired. I mean, Redfield is an appointed position as head of CDC. Fauci has his own position, but he was the most visible person on the media. And Birx was appointed as task force coordinator. I got the feeling through conversations with others in the White House, as I articulated in my book several times, I was told, we have an election coming up, don't rock the boat. And my answer was always the boat. Okay.
Yep.
Frankly, I didn't care about rocking the boat. People were dying.
Yeah.
Okay. It's not political. I didn't have any motivation other than stop people from dying. Yeah. That's the point. Okay. And, I'm not a politician. I didn't go there to make friends. I didn't go there to make enemies, but I didn't go there to make friends. I went there to do the best job I could because it's my country.
Doc, help me with this because, you just made me ask a whole bunch of questions in my head with that answer that you just gave. One of them is, maybe you've answered in that they didn't want to damage any sort of future plans with the election so the president get back in office. But I'm trying to figure out how Fauci and Birx got what they wanted over you're coming in 6 months later, bringing in new information, new content to the situation. nobody seems to really be challenging your facts. How come that wasn't like a huge switch that you didn't get what you wanted and implemented in? Was like, well, this is better data. Here goes the data that nobody's talking about. You know, I don't understand, especially if the president's the one who's implementing this
and bringing you on.
He's asking for you.
Yeah.
You know, how is it that you didn't just rise to the top and say, we're done with this?
Well, I mean, it's a little bit more complicated that people don't understand. The federal role is not the actual on-the-ground policies. The federal role is to give the guidance. The governors in our system, they demanded and they got, and it was appropriate to have them get the control of their own states. So Dr. Birx personally wrote, by the way, all the guidance from the task force to every single state. She wrote it. Wow. She wrote and visited dozens of states with or without the vice president. I visited one single state, Florida, during my time in Washington. They did something very different. But the governors decide what to implement. The federal role on the logistical side, on Operation Warp Speed, on developing drugs and vaccines, on supplying medical equipment, on supplying personal protective equipment, on supplying money. That was all done, and that was done fairly well after a sort of a disastrous start at the testing that was preceding my time there by several months. But eventually they had developed a large testing apparatus. But the medical guidance was simply that guidance. The CDC is supposed to give just guidance. They're not supposed to set policy. But that guidance that was implemented all over the country was the Birx-Fauci guidance. So it's true, by the way. This is sort of got lost in the media attacks of being a political year. But the president was giving the message of stop the lockdown, open the schools, protect the high-risk people for months before I came there. And that was the common sense policy. On the other hand, the official White House policy was that coming out of the White House task force, and that was very different. So it was chaotic. And in fact, that discordance, that chaos, in my view, was very harmful in and of itself, because that instigated fear in the people. And when people are afraid, and the American public is still afraid, and at this point psychologically damaged, I can go through how I know that. Yeah. But for months, the chaos of the White House, the media piling on saying the president isn't listening to the scientists and all this, the discordance of messaging to the people was harmful, because when you are afraid, you act irrationally. Yep. Everyone would. That's what fear does. And unfortunately, the lack of critical thinking, the lack of reassuring the public about what we knew instead of what we don't know, was simply abrogated. That never occurred from Drs. Fauci and Birx. We know a lot. We know a lot about decades of virology research. Yes. This is medical school 101, there is such a thing. That's right. This is actually high school AP biology, some of this stuff. And unfortunately, the people who were in charge were both incompetent, unprepared, and frankly, the wrong people to be in charge. And it's very sad that they were delegated such authority.
So
I really want to know. You said you can prove that we're psychologically damaged. What do you point to get that kind of information? I'm intrigued by that.
Well, sure. I mean, you don't have to live in California where I do to see the psychological damage, because these people are irrational. But there's data on this. What is the data? Okay, the younger generation particularly was severely harmed, and it will take decades, if ever, to unwrap that harm from them. Why do I say that? Okay, well, first of all, we knew back in June 2020 that this is June 2020, just after the first 3 months of the lockdown and the isolation, 1 in 4 college-age kids thought of killing himself. Okay, there was an explosion of depressive disorder, of anxiety disorder in young people. Teenagers in the United States, there was a significant increase in suicide attempts by teenage girls during the isolation of the 2020 lockdowns. There was a tripling, 3-time-fold, the number of medical visits to doctors for self-harm by teenagers during 2020 lockdowns. What does that mean? That means kids putting out cigarettes on their arm, slashing their wrists. Okay, this is very graphic, and it's sad to say it that way, but these are people.
That's right.
Okay, we had an explosion of substance abuse by teenagers. We have an explosion of opioid abuse. We had, by the way, 52% of college-age Americans during 2020, more than half, had an unwanted weight gain, and that averaged 28 pounds. Okay, This is a public health emergency.
Wow.
We have more than half, 50% of college-age kids in the U.S. answered a survey question that they are afraid of all social interaction. Okay, this is not trivial. These statistics are never stated. In fact, by the way, when I was in the White House, I was the only one talking about the damages of the lockdowns, the damages of the policy. Instead, what we saw was a singular focus, an irrational focus, and actually a sinful focus on simply eradicating COVID-19 at all costs. That is the absolute opposite of what a legitimate public health expert does, because public health means all health, all people. It doesn't mean just one infection. So this was a heinous abuse of our younger people and abuse by the public health leadership in the United States.
I'm bringing up the data. I think in 2021 here in Idaho, there was an 85% increase in sexual assault reports in Idaho. An 85% increase in 2021.
There's hardly anybody here.
We live in Idaho. That's why I bring that up.
Okay, yeah.
It's just unbelievable what that did to Idaho. That still kind of brings me back to the tension between Trump knew the logic and the reasonable approach to take, and yet Dr. Birx and Fauci were contradicting him in that. Why would he let that persist for 6 months? I mean, we know he was the TV host that would fire everybody. He knows how to fire people.
Yes, he does. Well, I don't know. I can't, I didn't ask him, why doesn't he fire these people? Yeah. It was so obvious. It was too obvious to ask.
Yeah.
But I can tell you that I was constantly being told by others, not by the president, by others, that I should not speak up. I should not go to the media. I have to watch what I say. Don't rock the boat. And it was harmful to the country. I mean, we can conclude that without speculating that when we have people who are incompetent, who are delegated that sort of authority, we see what happened. I mean, it's proven that the lockdowns of Birx Fauci failed to stop the infection spread. It's proven that they destroyed people. It's proven that they failed to stop people from dying. And but we knew it then. And, it's very sad. I don't know how to answer the question because I was not in charge of anything, as we all know.
Doc, one of the things that when I opened up your book, and first of all, I got to tell you, man, reading the opening of how you were brought up and how you were raised and your parents and how they raised you, and it reminded me of the kind of people that built New York. You know what I mean? Those kind of founded, grounded people. I was like, I identify with this guy. He's a man's man. He's going to tell the truth and he's going to live and die off of that principle. Doesn't seem like there were a whole lot of people that were there with you on that ground. And so I appreciate you being there for one, but it has to be absolutely confounding and dumbfounding to be able to bring facts into a situation, evidence and data into a situation, and not have anybody really pay any attention to it, to even investigate it. So when you look at, the title of your book, A Plague Upon Our House, it doesn't seem like the plague has to do with COVID.
There's a bigger plague there.
What's the plague?
Yes, well, there's a bigger plague. I mean, we don't want to, and I am never going to underestimate that so many people died from COVID. There's no question that happened. But the real problem, the bigger problem, was the mismanagement of the pandemic, unprecedented use of severe draconian lockdowns that, by the way, have never been used in the previous century of pandemics.
Right.
This was a complete error. But also, even in May of 2020, I wrote a paper with other people at other institutions, including University of Chicago economist John Burge, Ralph Keeney, emeritus professor at Duke, and Alex Lipton, a brilliant mathematician and computer scientist, on how the actual harms of the lockdown by May of 2020 had already doubled the harms in life years lost from the virus. It wasn't new. It's not learned over the last year or 6 months. This was known. It was not something that had to be discovered last month or this month from the Johns Hopkins paper. So it was extremely frustrating. But it's a tragedy, frankly. It's a tragedy. The plague that we're left with, once people recognize that the pandemic is essentially winding down, once we recognize what we're left with, we have a problem. And the problems, as I alluded to in the book, are really a disintegration of trust and a complete lack of substance in the institutions we depend upon most to advance the truth in a free society.
Your book was a perfect parallel to what's going on behind the curtain as we're experiencing what's going on out in the rest of the world. You're seeing what's going on behind the curtain. And me and Gabe were talking about how we're seeing Trump catch COVID, and you're explaining what's going on behind what you're working on. Your team have just pushed forward.
The panel you're working on,
the panel you're working with, and it's kind of these things that are getting subverted, in one way or another. But my question, though, with being able to be behind the curtain and see all this take place, what are some of the things that you walked away with that you learned in the end of the day with all of this? Because I don't think this is over yet. I think we're still in the first half of this game, and we got to figure out some ways to respond to this mess that we're in.
Well, I learned, of course, several things. Some of them are very simple. One is that we absolutely have a media that is completely untrustworthy, that does not work for the public good. And I'm making a generalization here knowingly. The vast majority of the people in the media have their own agenda. They distort what's said. They don't just distort, they make up things. I never understood this before I went. And this is very harmful because we in America rely on journalism to sort of, investigate the truth. They're supposed to be unbiased. They're supposed to be truth seekers. That's just not true. And that's very dangerous. Yeah. The second thing that I learned was that people in government many of them are grossly incompetent. And what I mean by that is when you have a bureaucrat pretending to be the nation's top infectious disease scientist, as some of them have been decreed, or declaring himself as, quote, the science. Yep. Okay. This is not just shocking and really, I've never worked with people this low level in my entire career. Now, admittedly, I've worked for decades in some of the finest academic medical centers in the country, University of Pennsylvania, Stanford University, et cetera. But this is shocking. We cannot have incompetent people rise to the top because they are able to navigate a political bureaucracy and somehow head agencies. We need to involve outside people when things are tough. And some of the other things I learned, unfortunately, I learned two things about American people. I like to say this. The two things that shocked me the most were the incredible power of the United States government to simply decree shutting down schools, businesses, your personal life, stopping you from seeing your elderly parents, limiting your personal movements. I never envisioned this was possible in a free society like ours. But the thing that really was very eye-opening was the acquiescence of the American people to these edicts, many of which were arbitrary and wholly unscientific. Now, that's a very negative lesson about people. Partly it was fear, but I frankly I don't buy into the fear anymore. We've been at this for 2 years. Okay, you got to be an adult. You got to think up yourself to make the best decisions for your family. But I will say this as a positive thing. What drove me, even though I was being pilloried or whatever, the press didn't understand, and the politically minded world of Washington didn't understand that no matter what they said, I wasn't going to stop because I had thousands of emails sometimes thousands per day from all over the country and indeed outside the U.S. praying for me, begging me to keep going. Pastors, bus drivers, parents, mothers, fathers, grandparents, high school students begging me to keep going. People depend on truth tellers. I'm not trying to pat myself on the back, but at some point, you have to stand up for the truth. And, it's just too important. And when you realize so many people are depending on you, your motivation supersedes any kind of trivial political attack. These people in journalism, a lot of them are frankly idiots. They don't know anything. They're there to, to antagonize you, to make you look bad, to investigate you. I mean, this kind of stuff was done from day one when it was visible that I was there. But I had a much more important, motivator. That's just, people that are interested in the truth, they're not going to stop by that kind of personal attack.
Dr. Atlas, we appreciate you, man. Reading your book, it's good to know there was a champion in there for us.
And a plague upon our house.
Yeah, my fight at the Trump White House to stop COVID from destroying America, and America is not completely gone yet. Everybody needs a copy of this book so they don't never forget what we just got done going through and what was happening in the highest place in the nation. Dr. Atlas, thank you so much for joining us here on Cross Politic. If you're single, get married. If you're married, have kids. And if you have kids, go baptize them. Until Sunday, love God with all your heart, soul, mind, and strength. Love your neighbor as yourself.